Thank you, Mr. Chairman. Thanks for holding this important hearing today. It's a topic that affects all of our constituents, I'm sure. I will tell you that in 2014, we had one constituent case of identity fraud. In 2015, we had 32. I don't know if that's consistent across the states, but you know, that kind of an increase, unfortunately, is an indication of the growing problem that we're all facing. I am very concerned, particularly about Mr. George, your report as the Inspector General for Tax Administration indicating that the IRS has not established an IRS-wide approach to authenticating someone's identity. I'm open to more funding. I, for one, believe, as you know, we've talked about this, that more funding may be appropriate, as we did at year-end. But I want to be sure the money's well spent. So I look forward to following up with you on that. But I want to, if I could, shift to another issue this morning. It has to do, Commissioner Koskinen, with a very urgent issue for a group of our constituents. And Senator Brown and I have worked closely on this issue. I think he has similar concerns to mine. I look forward to hearing from him on it in a moment. But this has to do with the health coverage tax credit. As you know, Section 407 of what was called the Trade Preferences Extension Act last year reinstated that health coverage tax credit through 2019. And basically, it extended the advance monthly payment program, which is essential. It's a program that gives advance premium payments to these HCTC recipients. In that statute, the program was to be in place 1 year from the date of enactment. So in this case, we enacted it in June of 2016. We said that it would have to be in place by June 2016, this year, 1 year. We were unfortunately told on March 7th of this year, 9 months after the bill had originally passed, and by way of a letter from you, Mr. Commissioner, stating that the IRS would not be starting the advanced monthly payment program by June as required under law, but that you all hope to start making advance payments by January of next year, so January of 2017. So this has caused a huge problem. 6 months go by, we don't hear anything, and then all of a sudden taxpayers are told that the rug's being pulled out from under them and we're not going to go ahead with this required advance payment program. Expecting that they're going to get this advanced monthly payment starting in mid-year, a lot of these taxpayers signed up for the health coverage in December and January. They thought they could get premium help, of course, starting on July 1st as required under law. And this isn't an easy decision to make. These premiums, as you know, are thousands of dollars per month. In some cases, taxpayers had to borrow money from family and friends, borrow from a bank, or take money from their retirement accounts early to pay for these full premium prices in the first 6 months of this year, knowing that help was coming. Furthermore, in some cases, these taxpayers had the option of receiving premium subsidies for plans on the healthcare exchanges, but they turned down that opportunity because they wanted to stay in their private plans, which a lot of people do, and because they fully expected to get this 72.5% premium assistance starting in July. So by the time the middle of March 2016 rolls around, these taxpayers have made a lot of life-altering decisions based on the fact these advance payments are going to be there, and again, they have the rug pulled out from under them. These are resilient folks. They've been through a lot. These are people who were left behind, frankly, by our own federal government in terms of their health care and pensions. They can plan for stuff, and they've done this. When the HCTC was unavailable in 2014 and 2015, they made sacrifices, and they got by. But again, to pull the rug out from under them 3 months before they're expecting this help is unacceptable, completely unacceptable. And the fact that the IRS had July, August, September, October, November, and December of last year to provide them with some sort of notice, to me, is also unacceptable. And the options left to these taxpayers now to try to find another way to fund these premium payments for the next 6 months, or have to drop health care plans altogether because they can't afford them, is also unacceptable. So I understand our staff, Senator Brown's staff and mine, have been working to try to find some sort of solution so that these advanced monthly payment programs can get up and running by July. We've been having discussions about alternative methods of administering the advanced monthly payment system so they're ready to go by July as required by law. I would just ask today, Mr. Commissioner, that as you have in the past on some issues, you get personally involved in this and help us to work out an arrangement so that we can be sure that we don't have an unacceptable result.
Right. Now, I've actually been personally involved since it was passed because it is a critical program, and one of our obligations we feel is a high commitment is to implement statutory mandates. As we advised people when they were considering this, the last time the program was initiated, we got a $74 million appropriation to go with it, and that allowed us to hire a contractor to set the program up, and it ran well. This time, we got no money, but we said we were going to do our best. The reason we didn't notify people until the 1st of March was we worked very hard trying to see if, in addition to allowing people, which they can, file in 2014 and 15 for reimbursement, we could get the advance payment up and running. And as soon as we figured out that we would not be able to be up in June, we notified you and everyone else. But I understand your points are exactly well taken, and we don't take them lightly. If there were a way to do it, we would. I would say, in addition to the $74 million, the last time the program was set up, it took 2 years. If we can get it up and running by January, and we're committed to doing that, it'll be a year and a half. So without any funding at all, we'll be 6 months faster than the last time. But your point is still valid. It doesn't necessarily help people who, in fact, are waiting for those payments. The fact that we'll reimburse them after the fact is still a burden for them, and we regret that, and we're delighted to work with you and Senator Brown to find any way to get there before January, but our commitment is that we will be able, we have to build systems to make payments. We normally don't make monthly payments, so we have no system to do it. We can do the credit at the end of the year because we give credits, which is why we could get 14 and 15 up and running. But we are delighted to work with you. We recognize that this is a burden on a number of people who have had a lot of other problems as well.
Well, it is a burden, and again, Mr. Chairman, thank you for your indulgence, but nothing you have said explains to me why we wait until March, mid-March of 2016, to tell people that these life-altering decisions that they've made are not going to work out for them. They've got to now find some alternative, which in many cases is going to mean, again, they're not going to have health care coverage that they fully expected under law. So I do hope that you will instead work with Senator Brown's staff, my staff, to come up with an acceptable solution so that we can get these people some sort of coverage through this advanced health care.
I would do that. The reason it took us till February, we actually made as good a faith effort as we could to see if we could get it done. We thought there was one possibility we could get it up and running. We worked on that and finally decided that in February that the IT systems just would not be ready. But it was not because we didn't care about it. It was because we were actually trying to see if we couldn't make the year deadline. But it will work with you. We're delighted to do that.
Senator Nelson.